Despite the easing of the COVID-19 restrictions, the pandemic's negative effect on youth mental health is likely to last for a while. Last fall, the American Academy of Pediatricians declared a national emergency in child and adolescent mental health. In December, the U.S. Surgeon General issued an advisory on youth mental health crisis. Municipal producer Yu Xiaoyuan talked to local experts to learn more about the mental health challenges in Needham schools and what the town can do to help.
As the director of the district's guidance department for 16 years, Tom Denton sees how the isolation, grief, and uncertainty of the pandemic have taken a serious toll on students' mental health. He said it's important for the community to understand its long-lasting effects and the continuous needed support.
To realize that, even if you're blessed that you're kind of navigating this in a way that's not tremendously difficult, there's really a wide range of struggles that are going on. And I know many people are kind of tired of COVID, but we're still dealing with it, and I think we're going to be dealing with the effects of it for a while.
Director of Needham Youth and Family Services Sarah Shine said over the past 2 years, not only has the demand for mental health support grown, but the symptoms they deal with have also escalated.
From maybe some mild symptoms of anxiety, which we were seeing before the pandemic, to I can't leave my house, I'm having trouble going to class, I get so anxious I can't reach out to my friends. Same with the depression. Youth who maybe had some depression that they were able to manage internally, this is now spiking to I can't get out of bed for days, I'm so depressed, I can't get my work done. They're not finding enjoyment in things that they used to find enjoyment for.
Shine said she's also seeing a significant increase in cases of eating disorders, suicidal ideation, and substance use. Sometimes the anxiety could come from the parents.
There's been loss of jobs. There's been parents are anxious about what their kids are doing. So when parents are anxious and having all these difficulties, that trickles down to the kids as well. So whole family systems are stressed.
On the other hand, mental health care providers are seeing an overwhelmingly long waiting list.
Right now, we have a wait list of about between 35 and 40 youth, and typically at any other given time, we have between 10 and 20, and we're able to move kids off of our wait list pretty quickly, and we're just not able to do that right now. Our wait list, I would say, is probably 6 to 8 months. I'm hearing similar things from other organizations.
We have students who need to be evaluated, will go to a hospital and need to wait hours and hours and hours before they're seen. And at times, the few students who need to be hospitalized, the hospital beds aren't available. A usual resource that many of our students utilized is really less available, which increases the pressure on the school to really provide those services.
Beginning this school year, Needham added one more personal counselor in high school. Plus the 2 existing positions, each personal counselor can provide clinical support for about 50 students.
They're providing higher level and more frequent mental health support for students. To be able to add another counselor who can work with an additional 50 students who are really struggling has been very, very helpful.
At the middle school level, the district hired a transition counselor to guide students to rejoin their classes after being absent from school for various reasons.
Typically, the transition counselor at the middle school and the high school will work with students for about 4 to 6 weeks and help them add more and more classes until they're back in school in all of their classes full-time.
Due to restraints of the pandemic, students are floundering in developing social skills. Lower grade students interact less with their peers outside of school.
In the past, going over their friend's house, play dates, etc., those have really been diminished. And those are really how you learn the social skills to really get along with and to really work things out with friends.
High school students feel less confident about being independent.
In terms of travel, in terms of being able to get in her car and go visit friends, friends getting together to go to events, to go to Boston, things like that, because so much of their behavior is restricted. They're less independent, they're less able to feel comfortable going out in the world, doing the kinds of things we want high school students to do to really help prepare them for when they graduate, being able to go off to college or go off to work.
To help address the mental health crisis in schools, the Town of Needham and some community members also started pouring in resources. Needham Youth and Family Services is going to use a portion of the American Rescue Plan Act fund to hire an additional full-time clinician. A group of local professionals, Lighthouse, are going to initiate a series of workshops on mental health for parents. At the same time, Denton and Shine asked parents to be patient and do not hesitate to reach out for help.
Needham parents have high expectations for their students, and for a lot of our students, they're not doing quite as well as they have in the past academically. And I think for parents to really understand that, and while I would never suggest lowering and having low expectations, but to really understand how to continue to support your son or daughter or child without adding too much pressure and too much stress on them, given that for many of our students, they're really struggling to perform and to do the work and to feel a sense of confidence about themselves as a student.
When you're driving them in the car, ask them how they're doing, making sure you're really interested in their life and how they're feeling. We really want parents to engage with their kids. If they're playing video games or they're on their phone, see if you can engage with them, ask them questions about it. You just really want to keep them engaged as possible. I think whole family systems, if you're feeling really anxious, there are some organizations that offer kind of short-term crisis counseling that we can either do or we can help set up. We've done that with a couple of families, just to really, again, make sure that the family system can be resilient while they're waiting for kind of longer-term treatment.
You can go to Needham Youth and Family Services webpage and the Needham Public Schools COVID-19 Health and Safety page for more information on mental health resources. For the Needham Channel News, I'm Yu Xiaoyuan.